doing my scene survey. I'm looking for any dangers to me in this environment. I do not see any. I'm seeing how many patients do I have. All I can see is one person here. I'm putting on my gloves and I'm getting my kind of just general impression. It looks like someone's unresponsive, right? On the ground. Hey, can you hear me? You okay? You all right? Hey, you okay? Can you hear me? I'm checking for responsiveness. This person is unresponsive. I'm gonna check real quick. Open the airway and check for pulse and breathing. Head tilt, chin lift. Look, listen, and feel. Okay, I see chest rise. I feel a strong pulse. Now I'm gonna do a real quick check for bleeding and major trauma. Hey, hey, what's going on? Can you tell me what happened?
I fell off my bike.
You fell off your bike. Hey, my name's Catherine. I'm a wilderness EMT. I'm gonna help you out here, okay? Does that sound good?
Yeah, what's your name?
My name's Catherine.
Okay, hi.
Okay. So I have done my primary. My patient's now awake. I got a general idea of what happened. Now I want to assess. Can you tell me what your name is?
Callie.
Callie, where are we at?
At your house.
Okay. And about what time of day is it?
Afternoonish.
Okay. So I have a patient who is ANO ×3, but did lose consciousness. So a little concerning, and fell off their bike. Because you fell off your bike, could you just keep your head still for me? I'm gonna build a soft collar for you.
Okay.
Put the soft collar on, and just try and keep your head still until we go through the assessment, all right? So Callie, if it's all right with you, I would like to go head to toe to check your body over just to make sure you didn't get any bump scrapes or problems with your little tumble, okay?
Sounds good.
Okay, so what I'm doing is I'm starting up at your head, and I'm feeling for anything unusual, and you tell me if there's any pain. Anything there?
No.
Okay, eyes look at me, okay? Looking behind the ears, I'm looking in the ears, feeling the cheeks, open your mouth, okay? Gonna press here. Any discomfort?
No.
Okay. Now what I'm gonna do is press on your ribs. Any problem?
Slightly.
Slight, okay? I'm gonna lift up the shirt real quick and have a look at that, okay? Okay, right in here?
Yeah.
Okay, I see a slight bruise there. I'm gonna look at that again in a moment.
Okay.
Can you take a deep breath for me? All right. Now what I'm gonna do is roll across your tummy and you tell me if there's any pain or tenderness. Any problems there?
I don't think so.
Okay. All right. Now I'm gonna come down your leg. Any problems?
Ow.
Okay. So we're gonna examine this. And where was the pain?
On my ankle.
Okay. Down here.
Ow.
All right.
Don't squeeze it.
I won't squeeze it. Can you tell me what kind of pain you're feeling there?
It just feels really sharp when you squeeze it.
When I squeeze it. Okay. So I'm not gonna squeeze it anymore. I'm just gonna check over the rest of your body, and then I will come back to this and have a look at it. Okay.
Okay.
For now, we're just gonna give it a rest and let it heal. Okay. And feel better.
Okay.
All right. I'm going to I'm not going to press your ankle. I'm just going to feel for your pulse.
Okay.
Okay, we got a good pulse. Can you tell me what toe I'm touching?
My big toe.
Okay, you feel that?
Yes.
Okay, we'll come back to that in a minute to see the range of motion on that. All right, now I'm going to do the same thing on this leg.
It just feels sore.
Everything feels a little bit sore.
Yeah.
Yeah, that happens when you fall off bikes.
My knee kind of
You
hurts.
bike here often?
Yeah, all the time.
Yeah. You from the area?
Yeah, I live locally.
Okay. What toe am I touching?
The little one.
Okay. All right, I'm gonna lift this leg. Any problems here?
It just hurts.
Just a little sore?
Yeah.
Okay, nothing specific. All right, now I'm just gonna look at your arms.
Okay, that kind of hurts.
A little sore?
Yeah.
Okay, it looks like we have a bruise on the elbow.
Okay.
Okay. Squeeze hand. problems here?
No.
No. Okay. So were you out here by yourself?
Yeah.
Yep.
I'm just doing my biking exercises.
Your usual biking exercises, so you're familiar with the trail.
Yeah.
Squeeze. Okay. And I see you have your cell phone with you.
Yeah.
Okay. Let's move. All right. So there is one other thing I would like to have a look at, and that is your back, okay?
Okay.
So I'm going to roll you. This arm feels good. I'm going to roll you this way, and we're just going to keep your ankle still there. Put this arm over. I'm going to grab. On the count of 3, I'm going to move you, okay? 1, 2, 3. Any problem?
Yeah.
Look. Okay. Okay, I'm going to roll you back on 3. 1, 2, 3. Okay, so it looks like you got a little soreness in the ankle, and it looks like a bruise on your elbow and a little bruise here as well. That's what it looks like we're dealing with. So in just a moment, I'm going to wrap that up. I just want to take some vitals, okay? So what that means is I'm just going to put my hand here and count your heartbeat, all right?
Okay.
Yeah. And try not to move your head, okay? Okay. All right. Just one more moment. All right, Kelly, I'm going to ask you a couple questions, okay? Can you tell me if you have any allergies?
No.
No allergies, okay. Seasonal, nothing you're allergic to, no food, no, nothing like that, okay?
Okay. I do have seasonal allergies.
You do have seasonal, okay. But, and do you take anything for that?
No.
No? Any other allergies?
No.
Okay. And are you on medication?
Yes.
Yeah, what medications are you on?
Zonogram.
Sonogram, what is that for?
Epilepsy meds.
Okay. So you have a history of epilepsy?
Yes.
Did you have an episode of that when you fell?
I don't think so.
You don't think so? Have you had a seizure recently? When's the last seizure you've had?
Years.
It's been years, okay. And do you tend to have auras or any feelings prior to having seizures before you have them?
Yes.
Yeah, okay. What are those like?
Just seeing colors and
Seeing
stuff.
colors. Did you see that prior to falling?
No.
No. Okay. So do you feel, in your opinion, based on your history, that you had a seizure today?
No.
No. Okay. All right. Are you on any other medicines other than your seizure medicine?
No.
Okay. And your seizure medicine, is that something you take daily?
Yes.
Yes. Did you take it today?
Yes.
Okay. Is your dose the same as it always is? Any changes?
No changes.
Okay. All right. And how about any other medical history other than a history of epilepsy?
Nothing really. No.
Nothing else? Okay. All right. And how have you been eating and drinking today?
Haven't really ate much yet today.
Okay, so it's pretty late afternoon. You haven't had much to eat. Okay.
No.
How about drink? Have you had any water? Any drinks?
I had a little bit of water. I had like a water bottle full.
Okay. What size water bottle was that?
Like those ones you take with you everywhere, like those. I think they're 32 ounces.
Okay, like a 32-ounce bottle. So you've had one 32-ounce bottle and not much food.
Yeah.
Okay. Are you feeling a little lightheaded? Were you feeling a little lightheaded at all?
No, I was a little bit tired while I was biking.
Okay. I do have some snacks. Would you, after we finish and we get sit up and would you feel good about having a little snack and seeing how you feel about that?
Sure.
And you have no food allergies?
No food allergies.
Okay, I have a couple different things. I have a Think Bar and a couple gluten-free stuff, so you can have your pick of that, okay?
Cool.
How about going to the bathroom? How's that been for you?
Regular.
Yeah, so peeing, pooping regular?
Yep.
You haven't had a whole lot to drink. Has your pee been kind of yellow, or has it been normal?
It's been on the yellow side.
Yellow side? Okay. Well, I also have some extra water, so we can maybe try a little bit of that.
Okay.
Okay. All right, and leading up to this, so you were out here practicing your bicycling, daily bicycling. Can you tell me what happened prior to me finding you here?
It was just going along my usual trail. There must have been a rock or something, because all of a sudden I was just falling down, and I woke up with you there.
Okay. All right. Okay. Well, Callie, what we're gonna do now is, I think you're looking pretty good. I'm just gonna wrap up your ankle, okay? Can you tell me again, is it kind of a, I wanna look at this area again.
Okay, that hurts.
Is it an achy kind of sore pain?
It's just kind of achy when out.
Right here?
When you're not squeezing it, but when you squeeze it, it's real sharp.
Okay, and I see it's a little bit swollen. Have you ever hurt your ankle before? Have you ever had a sprain before, break, anything like that?
Nope, first time.
First time. Okay, I see it's a little swollen. This is just gonna hurt for one moment, okay? I gotta kind of feel what's going on here. Right there?
Yeah.
Okay. All right. I'm not feeling anything, but I'm not absolutely certain what we have going on here, okay? So I'm just gonna splint this, and we've got your cell phone here. I think it would be best, because you had a tumble, you lost consciousness for a few minutes, because when I found you, you were out, okay?
Okay.
So I would really like for you to get checked out at a clinic. Do you have a preference? I know you're familiar with this area. Do you have a preference for your hospital?
I guess it's just one of those standalone ERs will work. Nothing crazy.
Okay. Would you like to go to Shands or North Florida?
Okay.
We can certainly go to the standalone. The only issue is if there's any other issues, they may send you over to the big hospital. But if you want to go to if you're comfortable with the standalone, that's perfectly fine.
You can go to North Florida.
North Florida, Maine?
Nah, I think I can just pop this off.
I'd really rather
just bike home.
I know you feel that way, but because this might be broken, we don't know yet without imaging if it's broken or sprained. And if you walk on it broken, it actually could make the injury worse. Okay?
We can try North Florida.
Okay. So what we can do is I'm gonna call EMS, all right? I'm gonna let them know what's going on, let them know about your vitals. I'm gonna check those again, and then we're going to get help. The head of the trail is not far from here. I don't feel comfortable walking with you just because I don't really know what's going on with the ankle. Okay. Okay, so we're gonna walk over, we're gonna stay here, and you have your head still in a nice neck wrap.
Yeah, I totally forgot about that.
Yeah, I saw you did, that's okay. Yeah, and we're going to have EMS come check you out, okay?
Okay.
And I'm gonna stay here with you and check your vitals again, all right?
Okay.
And you can tell me all about your bike, it looks really cool.
Oh, yeah.
Yeah.
It's got stars on it and everything.